Hi, I'm Dr. John Puma. Welcome to the ChefMD video blog and the ChefMD question of the week, which comes from Gail in Edmonton, Alberta, Canada. Dear Dr. Puma, since I was diagnosed with fibromyalgia 5 years ago, I've researched this a lot to find the foods I can eat or not eat. Tell me about some healthy recipes. Thank you. Gail, yes, fibromyalgia is very difficult. Thanks for writing about it. Fibromyalgia is defined as having widespread chronic pain for more than 3 months and is associated with fatigue and morning stiffness and disordered sleep. One of the first things I do, and you probably have done this since you've had a diagnosis for 5 years, is make sure that patients with fibromyalgia don't have celiac disease or an autoimmune reaction to gluten that's abnormal and therefore present with fatigue and many other symptoms as well. Fibromyalgia and celiac disease are sometimes intermixed, and celiac disease is quite common. About 1 out of 133 people in the United States have it. And then what I do is ask my patients with fibromyalgia to be systematic, to document on a scale of 1 to 10 how they feel when testing specific allergens and chemicals. What I ask them to do specifically is to avoid artificial chemicals, to avoid common food allergens, and then add them back one at a time. The top 8 food allergens cause 95% of all food allergy in the United States, so those are only 8 foods. And once in a while, we find somebody who thought they had fibromyalgia who actually had a food allergy that we can treat in that way. The best trials of patients with fibromyalgia who've been successful in treating it with diet have been either vegan diet or vegetarian diet patients who've taken 7 months to see a difference. And as you know, this illness can last years. The trials that have been done, the studies that have been done with probiotics, the healthy bacteria in yogurt and kefir, and with omega-3 fatty acids from fish and walnut and flax have not been very successful. But there's been one Belgian study that showed that some natural anti-inflammatory and antioxidant substances such as glutamine and N-acetylcysteine and zinc, plus what they called a leaky gut diet, actually help patients with fibromyalgia. The most important thing I found is to don't give up. Be methodical and find a clinician that you can work one-on-one with, because going systematically through this disease will get you out healthy at the other end. Thanks for coming to the ChefMD video blog and for visiting us at chefmd.com. Come see us again next week. Thanks again. I'm Dr. John Puma.